Hi, I'm Yezel Zhang, and I'll be talking to you today about our topic, Pediatrics through the COVID-19 pandemic and the severity of illnesses. Have we been waiting too long? After the World Health Organization declared a global pandemic of COVID-19, providers noted a significant decrease in the pediatric ED visits and admissions, including routine visits, which in theory should not be impacted by the novel coronavirus. There is much speculation with the theory that patients are delaying seeking care due to perceived fear of being exposed to the virus. Particularly in the pediatric population where early interventions can significantly improve clinical outcomes, this begs the question, has delay in seeking medical care led to an increase in morbidity and mortality? This is a retrospective observational electronic chart review of all pediatric ED and inpatient visits during the state-implemented COVID-19 pandemic lockdown period of March to June 2020 compared to the previous year from March to June 2019 at a Level 1 adult and Level 2 pediatric trauma center. Our primary objective was to evaluate if patients being evaluated within the hospital were in a more critical state during the pandemic lockdown by looking at the likelihood of ICU admission rates. Hospital admission, hospital and ICU length of stay, ESI, which is Urgent Emergency Severity Index, were also evaluated, and admissions were also evaluated for surgical etiology and direct admission rates. A total of 11,133 visits were evaluated, of which a total of 8,680 ED-only visits and 2,453 inpatient visits were evaluated in the table shown below. For our primary outcomes, the odds ratio of ICU admissions were evaluated, which showed a notable increase of 1.26 in 2020, as you can see in the table below. Our secondary outcomes also showed an increase of odds ratio of 1.57 for admission in 2020. (2020) also had an increase average and median ICU length of stay in comparison to 2019, as you can see in the box plot graph and the bar graph shown below. There was also no notable change of hospital length of stay for both years, as noted below in the figures for the box plot graph and the bar graph. ESI scores of 1 being most severe and 5 being least severe showed level 1, 2, and 3 being more likely in 2020, whereas level 4 was more likely in 2019, as shown below. There was also a higher likelihood of being directly admitted during the lockdown, of the odds ratio being 1.86, and surgical admissions, of the odds ratio being 1.22. Although overall number of pediatric patient encounters has decreased during the pandemic lockdown, outcomes suggest that pediatric admissions have higher severity and increased utilization of critical care. This increase in resource utilization may reflect delay in seeking care due to perceived risk of in-person medical evaluation. Hopefully, the study can support providers in urging patients to seek timely and appropriate emergency evaluations and interventions to avoid potential complications of illnesses that otherwise would be prevented. Thank you very much.